Hello, I'm Kevin Berger. Studies show 1 out of 5 Minnesota children will experience mental health challenges, yet only 20% will get the help they need. For more than 130 years, the Washburn Center for Children has been working to meet those critical needs. The organization is opening a brand new facility in Minneapolis. Here with more is Washburn Center CEO Steve Lepinski. Welcome back to Newsmakers.
Thank you, Kevin. It's good to be here.
Tell me about the services that you offer at Washburn.
Sure. Washburn Center for Children really is a children's mental health agency. So we work with just under 3,000 children a year from birth to adolescence with a whole array of social emotional behavior problems, anxiety, depression, kids who experience trauma, impulse control problems, really the whole range of issues, and it's all on an outpatient or non-residential basis.
How important is it that these, in some cases, very critical issues be addressed when children are children?
Sure. We think it's extremely important. There's several 100,000 children in Minnesota who have some type of social emotional behavior problem that's interfering with their lives.
Wow.
And for the most part, these kids are unhappy. Their families are very stressed. Generally, they're not doing well in school. Mental health issues impair learning. And these are kids who, if we don't identify them and get them help when they're young, go on to become, have more serious problems and end up, for example, in our juvenile justice system where at $40,000 or $50,000 a year we incarcerate them.
How much is shame a problem for people who need help? We hear about the stigma
Sure.
associated with mental health issues, and children are supposed to be happy.
Sure. I think it's still an issue, but I think we've also, as a community and as a country, come a long ways. It's much easier, I think, now for people to talk about concerns that they have with their child without sort of sending the message that I must be a bad parent or I must have done something wrong. These are just issues that affect some children. Some of it's biological, some of it's just a part of their environment that they grow up in. And for some kids it's clearly an unhealthy situation. They've been affected by violence in their life or some type of trauma. But really these are things that kids can get help with.
And in the new facility, are you going to be better positioned to serve? Because we hear that there's a big backup in this system.
Sure, there really is. And at Washburn, for example, we've more than doubled the number of kids we've served in the last 6 years.
Wow.
And it's not because the problems are getting any worse, it's because we as a community, again, and at Washburn, have found some ways to access resources to be able to serve more kids. As we get in the new facility, we'll be able to serve even more children.
The idea that there are more children seeking these services, are more kids suffering with mental health issues, or are we just identifying them in a more effective way now?
I think it's a combination of both, but I think the biggest part of why we're serving more kids, not just at Washburn, but in a broad community, is because we recognize the problems. And they're being identified in school, they're being identified in daycare centers, they're being identified better by pediatricians, and so kids are getting accessed into the system in 2 places where they can get help.
I think in Minnesota we like to consider ourselves progressive. How are we? I'm sure you're aware of what's going on nationally. On that continuum, where are we when it comes to addressing children's mental health?
Yeah, it's a hard question to answer because I don't know as much about some of the other communities. One of the things that I think is very important with this new facility, I think this really is kind of a manifestation of the community stepping up and saying, we want to do something about children's mental health. And I don't know that too many or all other cities across the country have done that. So, the corporate community, foundation community, public sector sort of all came together, really as we've done for children's hospitals, and said we're going to create a place for our physical health in Children's Hospital, our children's physical health. Here we're going to create a place that'll address our children's mental health.
Steve Lepinski, thank you for all the work that you and the folks at Washburn do. If you'd like to learn more about the many program services offered by Washburn Center for Children, find out how you can support their work online. It's washburn.org. And that's it for this edition of Comcast Newsmakers. I'm Kevin Berger. Thanks for watching.